Women, don't ignore these 7 symptoms. This could signal a dangerous disease. Did you know that nearly 2/3 of women admit to putting off seeing a doctor, even when they suspect something might be wrong? That's a scary statistic, right? We often brush off subtle changes in our bodies, attributing them to stress or just being busy. But what if those seemingly insignificant symptoms are actually our bodies trying to tell us something important? Today, we're diving deep into 7 silent disease signals that women often ignore. These are subtle clues that something might be off with your health, even if you feel fine otherwise. We're talking about those little things you might not even think twice about, but trust me, paying attention to these signs could be life-changing. Remember, this video is for informational purposes only and isn't a substitute for professional medical advice. If you're experiencing any of these symptoms, please don't hesitate to reach out to your doctor. Red flag number 1, unexplained weight loss. Have you noticed your clothes fitting looser but you haven't been dieting or exercising more? While many people dream of effortlessly shedding pounds, unexplained weight loss can actually be a red flag. It's not about dropping a pound or two. We're talking about a noticeable and unintentional decrease in your weight, like 5% or more of your body weight within 6 months to a year. This could be due to a variety of factors, some more concerning than others. Hormonal imbalances, like an overactive thyroid, can rev up your metabolism and lead to weight loss. Other potential culprits include digestive issues like celiac disease or Crohn's disease, which can interfere with nutrient absorption. And in more serious cases, unexplained weight loss can be a sign of certain cancers. The key takeaway here is this: don't ignore sudden or significant weight loss. Talk to your doctor to rule out any underlying medical conditions. Red flag number 2, persistent fatigue. We all feel tired from time to time, especially in our fast-paced world. But when fatigue becomes a constant companion, lingering for weeks or even months, it's time to listen to your body. This isn't just about needing an extra cup of coffee. We're talking about exhaustion that interferes with your daily life, making it difficult to concentrate, stay motivated, or even perform simple tasks. Persistent fatigue can be a sign of various conditions, including iron deficiency anemia, which limits oxygen delivery to your cells. Other possibilities include thyroid disorders, which can disrupt your metabolism and energy levels, and sleep disorders like insomnia or sleep apnea, which prevent you from getting restful sleep. Mental health conditions like depression and anxiety can also manifest as persistent fatigue. If you're constantly feeling drained, don't brush it off as just being tired. Talk to your doctor to determine the underlying cause and explore treatment options. Red flag number 3, shortness of breath. Feeling out of breath after climbing a flight of stairs or going for a brisk walk is normal. But if you find yourself gasping for air after minimal exertion or even at rest, it's crucial to pay attention. Shortness of breath, also known as dyspnea, can be a sign of problems with your heart, lungs, or blood. Heart conditions like heart failure or arrhythmias can make it difficult for your heart to pump blood effectively, leading to breathlessness. Lung conditions like asthma, chronic obstructive pulmonary disease, COPD, or pneumonia can also cause shortness of breath by obstructing airflow. Other possibilities include anemia, which reduces the oxygen carrying capacity of your blood, and pulmonary embolism, a life-threatening condition where a blood clot travels to the lungs. If you experience sudden or severe shortness of breath, especially if accompanied by chest pain, dizziness, or confusion, seek immediate medical attention. Chapter 4, Red flag number 4, changes in skin. Your skin is your largest organ and a window into your overall health. So, it's no surprise that changes in your skin's appearance can sometimes signal underlying medical conditions. We're not just talking about the occasional pimple or wrinkle. Pay attention to persistent or unusual changes, such as new moles, changes in the size, shape, or color of existing moles, or sores that don't heal. Skin cancer, including melanoma, basal cell carcinoma, and squamous cell carcinoma, can manifest as changes in your skin. Other skin conditions like eczema, psoriasis, and rosacea can also cause noticeable changes in your skin's texture, color, or appearance. Hormonal imbalances, certain medications, and autoimmune disorders can also lead to skin changes. If you notice any unusual or persistent changes in your skin, it's essential to consult a dermatologist or your primary care physician for proper diagnosis and treatment. Chapter 5, Red flag number 5, unusual bleeding. Bleeding is never normal unless it's from a cut or scrape. If you experience bleeding between periods, after intercourse, or after menopause, it's crucial to see your doctor promptly. Unusual bleeding can be a sign of various conditions, including hormonal imbalances, uterine fibroids, polyps, or even endometrial cancer. Bleeding or spotting between periods can indicate hormonal fluctuations, while heavy or prolonged periods might be caused by uterine fibroids or polyps. Bleeding after intercourse can be a sign of cervical polyps, infections, or in more serious cases, cervical cancer. And any bleeding after menopause when your periods have stopped warrants immediate medical attention. Don't hesitate to discuss any unusual bleeding with your doctor to determine the underlying cause and receive appropriate treatment. Chapter 6, Red Flag, Number 6, Persistent Pain. We all experience aches and pains from time to time, but when pain persists for weeks or months, especially if it's severe or interferes with your daily life, it's not something to ignore. Persistent pain can be your body's way of signaling that something is wrong. It can be caused by a wide range of factors, including injuries, inflammation, arthritis, nerve damage, or even cancer. Pay attention to the location, intensity, and duration of your pain, as well as any accompanying symptoms. For example, persistent headaches could indicate migraines, tension headaches, or in more serious cases, brain tumors or aneurysms. Chronic back pain might be caused by muscle strain, herniated discs, or spinal stenosis, and persistent abdominal pain could be a sign of digestive issues, endometriosis, or even ovarian cysts. Don't suffer in silence. Talk to your doctor about your pain to determine the underlying cause and explore treatment options. Chapter 7, Red Flag Number 7, Changes in Bathroom Habits. Our bathroom habits can reveal a lot about our health. While occasional changes in bowel movements or urination are normal, persistent or significant changes could indicate an underlying medical condition. For example, persistent diarrhea or constipation, especially if accompanied by blood in your stool, abdominal pain, or unexplained weight loss, could be a sign of digestive disorders like irritable bowel syndrome, IBS, Crohn's disease, or even colon cancer. Changes in urinary habits, such as increased frequency, urgency, pain, or burning during urination, or blood in your urine, could indicate urinary tract infections, UTIs, bladder infections, kidney stones, or even bladder cancer. It's essential to pay attention to your body and seek medical attention if you experience any persistent or concerning changes in your bathroom habits. Don't ignore the signs. Your health matters. So, there you have it. 7 silent disease signals that women often ignore. Remember, your health is your most valuable asset, and early detection is key to successful treatment and management of any health condition. Don't hesitate to advocate for your health and seek medical attention if you notice any unusual or persistent symptoms. Your body is constantly communicating with you. It's up to you to listen. I'd love to hear from you. Have you experienced any of these silent disease signals? Share your experiences in the comments below. And don't forget to subscribe for more informative videos on women's health and wellness.